There we go. All right, so welcome everyone to the second in the Alumni Speak series, which is a collaboration between the School of Social Work Student Organization and the Alumni Board. My name is Claire Bergman. I am a board member of SWASO, and tonight we will be talking about the health specialization. So to give us some perspective and advice, we have 3 alumni who will be sharing their experiences working in the health field in a variety of different fields within that sector. So Ben Zaret returned to school in the fall of 2014 in order to get his Master of Social Work at Loyola University as part of a midlife career change. He graduated in the spring of 2016 with a specialization in health. His second level internship was at Rush University Medical Center in their emergency department, and he spent over 2.5 years as a social worker and discharge planner at Weiss Memorial Hospital, a small hospital in Chicago. While at Weiss, he worked with patients and families in the ICU, orthopedic and general surgery patients, and gender confirmation patients. Ben currently works at St. Francis Behavioral Health, a community mental health center where his interests include working with individuals with chronic illness and supporting caregivers. So welcome, Ben. Our next presenter that we have today is Megan Mccarver, who graduated from Loyola School of Social Work in 2017. Prior to moving to Chicago, Megan grew up in Indiana and attended Valparaiso University. I used to live in Valpo, so rock on. It was through her alma mater and through a therapeutic summer camp that she was drawn to the profession of social work. Megan found joy in helping assist individuals find their meaning and balance within each aspect of their life, whether that's physically, mentally, emotionally, and or spiritually. She also finds it a great privilege to listen to someone's story. And after completing her undergraduate degree, Megan attended Loyola School of Social Work to further pursue clinical social work and having an interest in psychotherapy. She has experience working in private practice settings, therapeutic day schools, employee assistance programs, emergency room settings, providing crisis stabilization, and currently providing individual and family therapy to children and adolescents at Lurie Children's Hospital right here in Chicago. When not working, Megan loves spending time exploring the city of Chicago, trying new restaurants, shopping, volunteering, and spending time with loved ones. So welcome, Megan. And then finally, we have Lori Levine, who is an Lcsw and a 2016 Loyola School of Social Work graduate. After obtaining her MSW, she worked with adults for 2 years at Holy Cross Hospital as a psychiatric social worker on the inpatient unit and emergency department. In 2018, she transitioned to Lurie Children's Hospital for a dual role as a psychiatric social worker in the emergency department and on the child abuse assessment team. Currently, she works on the inpatient psychiatric unit at Lurie's as a therapist and case manager, and her clinical interests include crisis safety assessments, anxiety, depression, and psychotic disorders. For self-care, she loves spending time with her dog, Cornelius, cooking, and reading. So welcome, Lori.
All right, well, welcome everyone again. Thank you for joining us. And so we know that the LSW process is especially important for all of our health specialization students. So just wanted to take a minute to remind everyone that the deadline to file the application is April 19th. So you should have received an email on March 12th from Doris Hernandez with the attachments, and you just digitally fill them out and send them back. So make sure you check your inbox and just make sure you fill that out. And if you have any questions, feel free to add them in the chat and I can answer them. Or you can also send a follow-up email to Doris, and I will drop those links in the chat for everyone as well. But regardless, we are going to encourage everyone to participate and encourage you to just add any questions you might have for our panelists as we move along. We have some questions, but this is really just more also to center any of your questions and any needs that any of you might have. So thank you, everyone. So I'm gonna start us off. I'm gonna ask Ben. So Ben Zaret, I just wanted to know, why did you decide on the health specialization?
I think going into social work, I always knew that I wanted to work with people with chronic physical illness. And thinking about it, that seemed to me the best way to approach it in order to both get the experience working with people in a therapeutic way, but also to be able to work with people in a hospital setting dealing with those chronic illnesses. Um, and yeah, I also just had really wanted to work in a hospital setting. So that was how I decided on it.
Yeah, awesome. Well, thank you.
And next, we'll throw it over to Lori. So, what was your internship in school, and how did that prepare you for your professional career?
Mhm. Yeah, I got really lucky with my second year internship placement. It was at Advocate Illinois Masonic in their first access clinic, which was a walk-in clinic for psychiatric assessments. So people from the community, from other referring hospitals, and then also people who had just recently discharged from Masonic's inpatient unit. And so my role was, I had a lot of observing I was able to do, and then was able to, once I was up and running, conduct psychosocial assessments, and then we would recommend different levels of care. And so I think it was put me in a really great position because it was like technically outpatient, but sometimes we would have to walk people over to the emergency department, depending on if, they were high risk themselves or others. But then it also kind of gave me some outpatient experience as well. And then a little bit of case management experience, making kind of some of those recommendations. Other things I think that really helped me were, I got to work on my documentation, kind of understanding how to speak and describe people clinically. And yeah, so, but definitely I kind of came into social work school with the intention, I think, just to do outpatient, but through that internship, I kind of like found my way into, more of the hospital setting.
Awesome. It definitely seems like the internship experience can really change your
Mhm.
perspective and where you want to go with your career. So, I think we always appreciate hearing people, like try something new that you've never done and see how it goes because you never know what may happen.
Mm.
Um, the next question I'm going to throw over to Megan. So, you have worked in a variety of fields, as we heard in your bio. So, how did the health specialization education prepare you for those different social work environments?
Yeah, I would say that it prepared me in the sense that I think the beauty of social work is that you can do various roles. So it was kind of nice when I was, graduating, just to say like I had my master's in social work, and so I think that opens up doors to various programs. And so I kind of started with a therapeutic day school, and that actually worked out because my internship supervisor actually had a dual role. So she worked at a hospital setting. That's how I knew her, actually at Advocate Masonic, where Lori was at. And then she also worked at Easter Seals. And I have a really strong passion for working with kids with disabilities. So it was really nice that that was kind of my first level of entry. And then also kind of with the health specialization in my internship, I had some experience with like crisis assessments. And so that kind of led me into like the employee assistance program. So knowing how to kind of take people not only in person, but over the phone, if they're in a crisis, how to, help them with services and navigate kind of what level of care that they need. So it's kind of cool. Each like experience I did, I think kind of like prepped me for the next step, because then I went into work in hospitals in the emergency room setting. And I do that currently at Lurie's, but then I also work in intensive level of therapy care. So like I said, it was nice after I graduated. I think it opened up a door, and then kind of each opportunity led into the next one, which was nice. And again, I think that was the nice part for the health specialization, but just in general, as a social worker, that there's a lot of possibilities, especially once you become licensed.
You're leading us right into our next question, which is about licensure. But I do agree. I think that the social work profession is so vast, so it's nice to hear that you can easily bounce between and transfer those skills. But I did want to ask you about the LSW. So how soon after graduation did you receive your LSW, and how did that impact your ability to get a job in healthcare?
Totally. I'm glad that you guys are asking this because I was under the assumption when I graduated to be like, oh, I'm going to be licensed. I'm going to like be in a hospital setting. I'm going to be a therapist. And it doesn't work that way. So I think this is helpful just to know in advance because no one at Loyola unfortunately told me. So what happens is you fill out this paperwork, which is super helpful that the school helps you through that and kind of tells you what to fill in. So after you send that information to them, they kind of do that initial step. Then what happens is after you graduate, you have to wait until you get your diploma back because there's a variety of forms that you have to send into the state of Illinois. So Loyola helps you with one part of it. Like I said, you have to wait for your graduation certificate, and then you have to send that into the state. Basically saying that I have my master's. This is the hours that I, attributed to school and my internship. So then you have to wait for the state to get back to you to say, hey, you're basically approved to take this test. Then you sign up through a website about which location you want to take it at and what day and time. So that's kind of nice. You have some flexibility to pick. But I would say that process leading up to when you graduate to when you can take and sit for that exam probably is 4 to 5 months. And then I would say that after you get, that's just for the LSW. When you want to sit for the Lcsw, so that's the higher license to do like clinical work, that's usually about 1.5 years after you get your LSW. So in that time, what the state will want is you to have so many hours of supervision by an Lcsw, and they're very strict on that, not an LCPC, but an Lcsw. And then of course, hours of where you've worked. A big advice I would say is when you are going to sit for your LSW or your Lcsw to ask wherever you're looking at to apply, do you have someone who is going to give me supervision, and are they an Lcsw? Because that's going to save you a lot of time and money. You can find people on an outside basis, but they will typically have you pay for those hours. So that's a long-winded answer, but for the LSW, about I would say 4 to 5 months. The Lcsw, about 1.5 years to 2 years after you graduate.
Well, thank you. Yes, I think this is a really crucial question. And I think each person's path to getting into health is different. So this is why we also wanted to open up the same question to Ben. So similar question, just asking, how long did it take you to get that LSW right out of the MSW program? And how did that impact your ability to get a job? And like, what did you do in the meantime if there was any downtime? So.
Right. So I think Megan said it pretty well, but I'll just add a little bit about my own experience. I also did, it took me about 6 months, 5 or 6 months to get the LSW. In the meantime, I took a job as a behavioral health counselor, which is basically a glorified babysitting job in a residential setting. The only good thing about it was I did learn a lot, and they provided supervision. So wasn't the best job, but as soon as I got that, I did start looking for hospital jobs. It did take me a little while to get a hospital job after starting to look, but as soon as I got my LSW, or I'd say 2 months after, I started looking for hospital jobs. And in terms of like interim jobs, I don't remember if this was a question that you were going to ask later or.
No, it kind of was. I just sort of wanted to know. So we know that there is that gap. What do you do in that gap? Do you just kind of sit and try to build up your skills, volunteer, take a gap year?
I would say, depending on your financial situation, take whatever job you can get that will provide, as Megan said, provide supervision. Whatever jobs will offer, allow you to work with just the MSW, like if it's something, even if it's not necessarily hospital related, it'll get you those hours to get your LSW or LCSW, and more importantly, give you at least a little bit of a paycheck to get you until, because even once you get your LSW, it's probably going to take a few months before you definitely land a job.
Yeah, I think that's really good advice because we have a lot of current second year students who are trying to figure out, okay, what's next for me? So this helps kind of clarify some of the steps that you can take in that meantime process. There is legislation out in Illinois to have students sit for the LSW exam in their second semester of their final year. But Illinois is slow, so we're still waiting for that to be implemented. So hopefully sooner rather than later we'll get there. But this year, definitely follow the advice of our alumni here. We did see a question in the chat, so I'm going to throw this one at Lori to start. But were there any electives you took that weren't necessarily part of the health track that you felt were beneficial to your career as a health social worker? And if anyone feels really strongly about this as well, feel free to jump in.
So I think I was in the mental health specialization, but I did take a lot of classes that kind of like overlapped with health. I think the best class, I took 2 classes that I found to be very helpful practically as a social worker. And one was like the clinical interventions class with Christy Mason. That was where we went through the DSM and went through every disorder, and then talked about an evidence-based intervention that would like address that disorder. So for like schizophrenia, like assertive community treatment, and for depression, CBT, things like that. And I felt like that was the best class that I took that's really helped me in my career and all of the hospital jobs that I've had. I also thought that the crisis assessment classes with, I forget his name. He was like a really cute man, bald man, kind of famous guy. He was really cute. Do you guys know who he is? Anyone?
I remember him, but I don't remember his name.
He kind of looked like, I say this respectfully, he kind of looked like a walrus. He was adorable, and I loved him. And that was really helpful.
Yes, thank you, Joyce. Dr. J. Callahan.
Dr. Callahan, yes, he was so sweet, and he was great. I'll say that I think that the most helpful part of my education at Loyola was definitely it's important to understand kind of, the history behind social work, the systems, like a lot of kind of like those theories that underlie it. But I really felt like the most practical and helpful part of my degree was my internship.
Awesome, thank you. Ben, did you want to add to that?
I was just going to second, like taking the crisis intervention, particularly in terms of working at the hospital, was definitely extremely helpful.
It's good to know because registration is tomorrow, so you can add it to your list.
Yeah.
All right. We did have another question that I feel like is kind of relevant to the previous conversation, so we can bring that up as well. Would you recommend getting an entry-level hospital job to gain experience in a hospital, or is there other health-based agencies you would recommend will provide introduction to that health social work field? And it says, asking as someone who has no prior hospital experience. I'm not sure if anyone feels strongly about this one specifically based on your background. Lori, you want to go first?
Yeah.
And then Megan, we'll throw it over to you.
Yeah, I mean, I think that Ben kind of spoke about this, when you're in that kind of like purgatory period after you graduate, especially if you're in health or mental health, that license is going to be really huge. So, I mean, I think that if you get an opportunity that you think will be valuable to kind of take more of an entry level position, that would be great. But I do think that there is, weight and value to just kind of breathing, if you're financially able to, like I like nannied for the summer after my graduation, and just kind of studied for my exam, looked for jobs. I took and passed my Lsw in September and then started working in October. And I was really glad that I did that because I feel like I was able to kind of like rest and recharge and really kind of like think about what I wanted and of course study for my exam. Um, there are definitely different ways to do it, just like there's many different ways to be a social worker. But I think that if you're looking for experience right off the bat, that's going to kind of like build a resume. I think that SAS is a good agency that if you're interested in mental health, like they don't require you to have a license, an Lsw at all, but you can get your clinical hours for your Lcsw. And then several of my colleagues at Lurie worked through SAS, obtained their Lcsw through SAS, and then transferred to Lurie. So that I felt like was a good agency that is like valuable experience.
We can include the link to like SAS's information in our follow-up email for everybody, because I agree that SAS is a really great way to get crisis intervention experience. Megan, we'll throw it over to you then.
Sure. So a couple of things that I would mention is that if you are able and you have an LSW and you want to apply for like an entry level position, I would do it. I got very lucky and I went to a job fair because I very much wanted to work at Lurie Children. So I like stalked them. And so they had this like social work fair that came up, and it actually worked in my favor because they were hiring for a position that I used to be in at the hospital. And they usually had accepted LCSWs. So they kind of grandfathered me in. So I got a position at a hospital as an LSW, excuse me. And then they gave me my hours to set for the C. So I would say in any way, like look at people's like job opportunities. If they have a fair, if they have a networking event, I would say absolutely like take a hold of that, because an opportunity ended up happening that I never thought I would take. And it worked out for me, which was nice. So I would say that. Look at what people are, networking opportunities and they're hiring for. But I think any way that you could get experience in a hospital, even if you have time to like volunteer, I think that shows a lot. We had some people like at Lurie's that volunteered for a couple of years. They were still doing school. And that also kind of showed their interest and involvement of like wanting to be at that hospital. So I think if there's something open, absolutely take it. You could do it for however many months in a year. It could lead into something full-time. I would also say too, I did like part-time work at a hospital. So I did like as needed shifts that they wanted in the emergency room. So it was good experience. And it was like kind of a side hustle I did for a while. And it was also good experience that led me into a full-time role. So I think anything you can get, whether it's part-time or full-time at a hospital, that's really helpful to put on your resume.
Great, thank you. And we did have a note that love Lurie. My daughter spent 3.5 months in the NICU, and it that's why they changed their specialization to hospital. So thanks for sharing that tidbit. I'll throw it over to Elizabeth then.
Yeah, I was actually going to throw this question. Okay. I was going to throw this question over to Ben. We had a question in the chat. It was about, would you recommend taking a class to prepare for the licensing exam, or did you join a study group to prepare for it? No.
I think it depends on the way you best study. I took a preparation class through NASW. I took it just once before my LSW and then reviewed the materials for my LCSW. There's also an app on the phone that lets you do practice questions. I found that extremely helpful. So I think definitely do something to work with people to prepare for it, rather than just trying to prepare on your own with no guidance, because it's basically it can feel like it's asking you to learn everything about social work And there's no way a 2-year program or 10-year program is going to prepare you for that. So get some of that kind of focus is really helpful.
Yeah. And I was gonna ask, was asking you this question because we had this conversation beforehand. But so is the LSW different to prepare for than the LCSW? Is it similar, the same? What would you say?
I prepared the same way. The only difference was I took the class right before the LSW. I chose not to retake it, but I did have all my LSW materials, so I just reviewed all of those.
And I don't know if anyone wants to add to that.
I'd like to. Yeah, it's totally dependent on how you learn things and what your anxiety level is. I found that the class, I also took the NASW class before my LSW. I did not find it helpful. They give you a book that's kind of helpful that you could also just buy. There's a really good one by Diane Apgar that I think I bought on Amazon. And I think that that kind of goes through a similar material to the book I got from NASW, and it kind of gives you a little bit more kind of rationale as to why, you know, like what the test is going to be looking for, kind of like what they're looking for. I found that to be a lot more helpful. And then, yeah, what Ben said about the Pocket Prep app, because you kind of just want to understand what they're looking for, you know, like I think that I spent a lot of time like learning about all of like Erickson stuff and all the, you know, defense mechanisms and like all that stuff. And like none of it was really covered on the exam. And so I think just kind of training your brain, because it's very formulaic how they're asking questions, you know. And then something I do recommend is taking, when you enroll in your LSW class, you can take an ASWB practice exam, which is formatted the exact same way that the LSW or LCSW would be formatted, like when you take it at the Pearson Center. And so for anxiety, just to kind of understand what it's going to look like, what's going to be helpful, but then you also get access to all of your incorrect answers and like why they were incorrect. You know, for like, I think 30 days or 2 weeks or 30 days after that. And I literally just like printed that out and just like, there's like themes as to why you would get certain questions wrong. And I think that that was the most helpful thing that I did.
Yeah, I would agree with what Lori's saying. And I think for me, the big difference was in the LSW. So the first exam that you take, that's all about like, what do you do first? Or like, what's best for your client? Like, it's a lot of like general questions. And it's all about other aspects of social work, but that was like a recurrent theme. More so for the Lcsw, because it's the clinical license, that's a lot of like, here's the age of somebody, here are their, what's going on in their environment, what's their diagnosis. So it's more related to like DSM. That's at least how it was on my exam, and some about medication. So it's again more clinically focused in the Lcsw.
In the LCSW, in my test, because again, not every test is the same, they also had a lot of questions about being a supervisor and like the ethics around supervision. So I would recommend looking into that for your LCSW.
Awesome. These are all great tidbits, and I've been taking notes so I can follow up with these in our follow-up email. There was another question in the chat that I wanted to bring up. Within the scope of your role at a hospital health setting, would you say attaining a CADC is beneficial? That's the Certified Alcohol and Drug Counselor, I believe is what that acronym stands for, through the School of Social Work. So does anyone have specific recommendations on that?
I think if you work in an emergency room setting, it can be helpful to know when people come in. And that's kind of actually came up in our team when people come in maybe high as a kite or they're intoxicated, like what's the level of sobriety of which we can see them and how is it interacting with like medications that they're taking. So I think it can be helpful, absolutely, if you're also like interested in that. But I don't think it's a hindrance if you don't have that license. I think it really depends like what you want to do. So like if someone was really, I don't know, passionate about that population, you wanted to work at like a residential, like Rosecrance, I think it absolutely would be helpful and probably necessary, but I don't think it's a must have. if you're just working in a hospital.
I agree. I never got my CADC. I think, as Megan was saying, it is helpful to at least have some exposure to understanding the effects of drugs and alcohol, because if you work in a hospital, you will see that. But I don't think it's essential at all.
Yeah, I agree with that. If you primarily want to work with addictions, like 100% get your CADC, but it kind of also in a lot of ways can kind of pigeonhole like the clientele that you know, the population you work with. So I would just like make sure that that's what you really like and are interested in before you commit that time and money.
Awesome. And I think there are some electives around that specific topic. So maybe if you're not interested in going the full certification, but you have, you know, you want that little extra education on that, maybe that would be a good way to throw that in there. Just want to follow up with the LSW from another person in our audience asked, does it make sense to take the LSW exam as soon as possible if you know you will not be going to work immediately?
Yes.
Yeah, I would say do it as soon as you can, because if you might, I mean, this depends on the person. You might get lazy and not come back to it. And I would just say it's a factor and it's good to have, because typically you get a pay increase and there's more things. When I say things, there are more jobs available to you if you're licensed.
Mm-hmm. And then I think like once you apply, you don't have to like register for the exam right away. You get a certain amount of times. Like I want to say even like a year or something. Like it's, you don't have to register within like a really brief window. So I think like if, while you have time, once you get your diploma, just to like kind of, you know, you don't have to, doesn't mean you have to take it right away, but it's nice to just get that paperwork over with.
Yeah, I will add, I spoke with the Doris, who I dropped her information in the chat for everyone to reach out to. So the deadline to file your paperwork is the 19th, but you have a year from when the paperwork goes through and your degree is conferred to sit for the exam. So just wanted to throw that in there.
Yeah, Doris is a great resource if you have further questions about the nitty-gritty details of the paperwork and stuff like that. We did want to shift gears. These are all great questions, so feel free to keep adding stuff in the chat. We do have some more from the SWASO end, specifically looking at the job search and the application process. So for Lori, when you began applying for jobs, what did the job search and application process look like for you?
So again, I took, because I was very like strongly committed to wanting to work in mental health in hospitals. So I just kind of like put my job search on hiatus until I had passed my LSW. I had like a brief second where I interviewed at an insurance company and it didn't work out, which is totally for the best. So once I got my LSW and was actively applying, I used Indeed. And honestly, that was kind of just how really once I got my LSW, I began getting calls back. Like I had interviews. I think by the time I like committed to my first job, I had like, you know, another offer and like so active. Like so it really like kind of like created like a lot of movement. I mean, I would say it was pretty standard applications and interviews. And yeah, I mean, it was, you know, I think like the biggest hurdle was really truly just getting the green light to just take that exam.
For sure. And if any of the other alumni, if you have like websites that you use that you want to drop in the chat for people or something that you found particularly helpful, feel free to add those as well. For Megan, when you began applying for jobs, what did the, so throwing the same question at you, what did the job search and application process look like for you? I know you talked a little bit about the Lurie's, their social work career fair, but what else was your process like?
Yeah, I think it was like I already said, stalking their page because I really wanted to work there. And I put in the chat, I used Indeed a lot and LinkedIn just to see like what was available. And anything that I thought was like pertinent to what I thought was interesting, or if I had like prior experience, I would just like apply. And I would say places usually would get back to you within some days. Interesting though, because everywhere applies differently. So there was some places that it was just like a phone interview and then I would come in person. Or I've had some places where it was like a 3-round interview of like meeting multiple people in the hospital. So it really depends on the place. But like I said, I just used Indeed, LinkedIn. I would type in the chat like therapist or, hospital social work. And I think something that we haven't brought up yet is it was important for me too, as I got into the health world, is that it's very different to be a psych social worker versus a medical social worker. And so I think that's also something you've got to think about too. So when I think about psychiatric social work, like Ben and Lori and myself have experience in, it's working a lot with like the mental health of individuals. Sometimes it's intensive levels of care, like a partial or an outpatient program, or being hospitalized. And then more medical social work is being on specific floors in the hospital, potentially helping with discharge planning, helping the families or guardians in various ways. So I think that's also something to pay attention to, because I know sometimes I would go into interviews and it would be more medically focused, and that just wasn't something I was interested at all. But if it was more psychiatric related, that's something that I wanted to do in the hospital. So I think that's just something to keep in mind. There's so many social work jobs that are offered, but it's good to know if you want to do maybe a psychiatric side of it or the medical side, or maybe both, your preference.
To follow up on that, just for when you're looking for those jobs, what was kind of the language that was presented in the description that you could kind of clarify? Like, did it specifically say like, this is medical, this is psychiatric, or did you have to do a little more digging?
Sometimes, I think sometimes in the heading, Claire, it would say like medical social worker on the PICU or oncology, right? So sometimes it would tell you the floor, or sometimes like what would happen at Lurie's, I would look and it would be like, oh, social worker. So you'd have to click on it and then read through like what kind of the expectations were. So the amount of like, patients you're going to see, what floor it's on. So sometimes you have to do some digging. So I think just kind of be aware what the kind of bio says. So I think another thing that I ran into was like, for like psychiatry, it was like doing individual and family assessments and ongoing therapy, right? So then I knew it was more related to what I wanted to do. If some was really geared towards, like I said, like discharge planning, that's not something I wanted. So then I just stayed clear of that. So like I said, I think I would just be mindful of what you're reading in their blurb of what the job requirements are.
Nice. I have a question regarding the Lcsw, and I wanted to throw this over to Ben. So specifically, for your Lcsw, I know you have to complete 3,000 hours, I believe, right? Where did you complete those hours, and sort of what was the supervision like in that situation?
Messy. So my first job, I got supervision at, which was not a hospital job. It was, as I said, as a behavioral health counselor. So there was an Lcsw there. When I started working at the hospital, and actually more specifically doing discharge planning, I did reach out to coworkers there who were Lcsws, because even though it was a small hospital, there were enough people who were Lcsws, and eventually I did find somebody who was willing to supervise. So just met with her on a weekly basis.
And that's where you completed your hours?
Yep. Yeah. So I got all my hours there eventually.
I wanted to ask Lori the same question, sort of where did you complete your hours and what did that supervision look like for you?
Yes. So yeah, my first job was at a hospital on the south side called Holy Cross Hospital, and I worked on an inpatient unit. And again, I asked upon interview, because that was a big deal to me, and I didn't want to pay out of pocket for that, especially because we're so underpaid as social workers as it is. It really, I think, is a very legitimate question to ask, and especially as you're making decisions about where you want to work. And so it was my manager at Holy Cross who supervised all 3,000 of my hours. So it was a team of my manager and then 3 social workers, and we worked on the various psych units. And so we did mostly group supervision once a week. And supervision is very helpful, especially as you have, challenging and difficult cases and you're navigating, um, kind of more nuanced situations. So I think that was really helpful. And then she would kind of, if we didn't have any kind of supervision we needed to talk about with our cases, she would pick different topics or ask topics that we would want to talk about. So that might be, certain diagnoses in the DSM, specific interventions, things like that. And then sometimes we would branch off and do our own individual supervision, but it was primarily group. I think really what prepared me the most, to take my Lcsw exam was absolutely the supervision, but really like, the day-to-day, like the collaboration, but amongst my social workers, kind of as we were handling cases live, the collaboration we did with, psychiatrists and nursing staff as well. So supervision is great. And especially as you're kind of, having your own feelings about certain individuals and families that you're working with. Like, to me, that was the most helpful part of supervision. I think the clinical, you're learning those 40 hours a week, really doing the job. So to me, it was kind of felt like a lot more, supportive. And then, make a little Excel spreadsheet and track those hours, because it's going to come up real quick. It takes, if you're working 40 hours a week, it's really only about a year and a half. So yeah, it'll come up quick for you for sure.
Wow.
Mhm.
I was going to say, so I had a follow-up question for you, Lori. So I'm not a health specialization student, but we created this because we knew that there was a huge need for this specialization specifically. And in my experience, I've already started job searching. In my experience, a lot of organizations that will provide a supervision are upfront about that, and they're very proud of that. Is that the same experience sort of in hospitals? Or do you have to like ask and maybe it's not going to be?
Yeah, I don't necessarily, like, I don't feel like in job descriptions or, like that it's automatically. I think that I would make a point of it to ask. And like even my intern right now, she's a UIC intern. She'll be graduating in May. She just got a job at Pathlight, which is a behavioral health organization, and they told her that she would get supervision, but as she's inquired, now that she's kind of onboarding a little bit, they were going to have an LCPC supervisor, which is not adequate. I think in the LCPC field, an LCSW can supervise you, and that's okay. But with social work, it has to be an LCSW. So I think like be prepared to just kind of continue to advocate and just follow up, because it's really part of the deal. So yeah, it's definitely not a given. I mean, hospitals are great. You're gonna really learn so much, and you're going to collaborate with all the different disciplines, and I think it's going to set you up to kind of do what you want. But hospitals are very disorganized.
I was going to add,
Mhm.
alternatively, if you're working in medical social work, it can be even more difficult. I know when I was working at Weiss, my managers were always nurses, because many discharge planning departments are run by nurses, and it's a collaboration between nurses and social workers. So for me, I had to look to coworkers, and actually the person who ended up supervising me was in an entirely different department. So that was a lot harder. Whereas at my first job as a behavioral health counselor, that it was more sold as part of the appeal for why they were paying us almost nothing.
That's interesting and kind of sad. but realities of the social work life, I guess. So I want to throw this one over to Ben, but I think, anyone could really jump in on this as you see fit. So do you have advice for the health specialization students regarding their resumes and interviewing, specifically tailoring to that field?
For if you're looking to do medical social work, working on a inpatient medical floor, I think the big things to make sure you highlight either during your interview or on your resume are being able to work in a fast-paced environment and be able to multitask, because um, that's the reality of working on a medical floor. And so specifically making sure to call those out at some point. For me, I always like to have anecdotes that can illustrate skills or lessons learned, or however, that's just a technique for me in interviews that I find extremely helpful and yeah, just helpful and easy to get to. So thinking about that, in general, just thinking about what's your biggest strength, what's a weakness that you could tell people that's not really a weakness, a challenge that you've overcome, a way to take um, a situation that was not in a hospital, but can be viewed therapeutically, especially if you haven't had that experience before or that direct experience, showing them that you can make that connection between, okay, well, maybe I haven't worked in a hospital, but when I was, working at this other job, it was similar in this way. Being able to have those, think about those beforehand so that you could go to those pretty quickly.
I think that's really great advice for all of us right now. But thank you. So as we're winding down here, so I want to make sure everyone gets their questions answered. So please add them to the chat. But I do have a question. I'm going to throw this one to Megan. So currently, I know, Megan, you work at Lurie Children's Hospital, sort of. What's next? I'm always curious to hear from people, sort of, what's the ladder? How do you keep growing? How do you become your supervisor, or do you even want to become your supervisor? No.
Question. I would say, it depends on the person, but I think the nice thing that you can think about in your role is that, especially where I'm at now, it's very clinical, and I'm